Good morning, everyone. Dr. Smith, physical therapist here, and today I'm going to take you through a PT eval. Also, this is going to be applicable to OT evals as well. So this is when you're doing an evaluation in the home. I'm going to use WellSky/Kinzer here just to show you everything you may see in an EMR. This is my favorite EMR, but we can go here. I blocked out the patient identity. That way there's no HIPAA violation. You're going to make sure it is the patient, make sure you're seeing the right person. So you want to confirm the patient's identity. You want their time in, the time out, the date, the mileage if you put it in here. For me, I write it down somewhere else. Where the care is provided, the medical diagnosis you can get from the chart, the PT diagnosis. And sorry, I just ate some really spicy food after my workout, so give me a second. So yeah, so we have the medical diagnosis, the PT diagnosis, relevant medical history. Here I put something like patient was recently hospitalized due to a stroke, prior level of functioning, usually independent with ADLs, mod I with ADLs, patient goals, usually to be as independent as possible. If they have any specific goals like return to sport, return to activities, return to playing bridge with the girls, return to bingo at the ALF, put that in there. Precautions, usually fall, standard of infection. Are they homebound? Yes, if you're seeing them for part A, they should be homebound. Part B, no, but most likely if you're in this group, you're just seeing part A, you want to check residual weakness or write in residual weakness, needs assistance, requires max assistance. You can check all of these. Again, if they don't have dementia, don't check this. Where does the patient live? So patient lives alone with other persons in the home and in the ALF. Assistance is available there. You can type in whatever you want. If we go back, we can see the hazards. So we're going to go and we'll look at hazards, none, steps, pets, ask them if they tripped over their pets, lack of running water, plumbing. If this is an issue of insects, rodents, you might want to call Health and Human Services or call your office and let them know you don't feel comfortable, especially if you're PRN, or get a social worker in there to help them find the resources. It really depends. You're going to have to assess the situation and decide for yourself. Evaluation. So this is all really part of the subjective exam and what you're going to get from the chart, and as well as what you're observing in the home and asking. When you actually start now doing the objective measurements part of the eval, you're going to take the temperature. I take a temporal one with a laser. I don't recommend you take a rectal. That's up to you though. There's oral, axillary, aortic. I use temporal. It's the most sanitary. Don't have to clean it, don't have to stick it on anyone's tongue. Blood pressure, the position, the side, the heart rate, the respirations, the O2 saturation you get from the pulse ox you should have with you, and if they're on room air or O2, and if they are on O2, how are they on it? Again, more subjective information here. You're going to have their orientation, the speech, the vision, the hearing, the skin, any swelling. If it is present, where is it? If it's pitting, if it's absent. Then you're going to look at muscle tone, coordination, and again, you can check these or you can write in everything you're finding over here. It's really up to you. I usually do both, but for this video, I'm just going to be very fast on it. Sensation, if they have peripheral neuropathy, I usually put PN right here. Endurance, posture, they have pain, the location, the intensity, what makes it worse, better interferes with. Here we can go through all the ROM, the measurements for whatever body part you're doing, or you can do all of it as well as the strength. You're going to assess bed mobility. Usually you can just ask them, do you have any trouble getting in and out of bed? And if you don't believe them, you can ask them to see it. The gait. You're going to want to do a tug. So a tug is going to be 30 feet. And if it's greater than 30 seconds in home, their risk for falls, less than 30 seconds, not a fall risk. There's a bunch of flowcharts out there too on different balance assessments. So you're going to assess all of this if applicable. If they're in a wheelchair, just write not able at the time. And you can go down here and do this. Weight bearing status, transfers. If an OT is in there and you're a PT, some of this you can write COT notes, their balance. And again, you can see all these cognition tests, the MoCA clock drawing, sensation, endurance, Borg, balance, Tenetti, Berg, single leg. Berg is more evidence-based. However, they're very low level. You can use a Tenetti, though it's been shown not to be as reliable as the Berg. Gait, tug, again I mentioned, gait velocity, balance. What DME do they have? Your assessment of your findings, your treatment goals, the treatment plan, who you talk to, if you notify the physician, if they can benefit or if it's eval only, completion, and then we can go into frequencies. Frequencies will be another video, and that's just because I don't want to give away any patient information by scrolling through this too fast and hitting the wrong thing. But frequencies will be another video, but this is how you do a PT eval. One thing I will say with frequencies is if it's Medicare, I usually do 2 week 4 and then reassess. However, if it's like Humana Medicare Advantage and you have 6 visits and you can only see them once this week, then I do 1 week 1, 2 week 2, 1 week 1. And again, frequencies will be another video, especially as I continue to build out the home health mentor course. And also what I have for you guys here, and I'll post this link in the video below, is if you go here, let's copy the link, go over here, is we have this eval. Again, don't steal it, don't try to sell it. As you can see, it says by using this document, you may not copy and redistribute. If you have access to this document, any attempt to steal and sell result in legal penalties due to IP theft. So if you copy this, I'll know where it came from and I'll sue you. So that's just the reality of the situation. I'm not trying to be a dick, but this is my content. So make sure that you use it appropriately and give credit where credit is due. So we can see this is what I would put. This whole paragraph here is what I would put in my clinical statement of assessments. And we can see that, it's PT visit required today for PTL for a patient with diagnosis of CVA, gait instability, and generalized weakness in the overall functional capacities with ADLs. Head to toe assessment consisting of everything we said. And patient responded well. The clinical exam shows that PT needed this team, why they're homebound, if they have pain, what they were able to verbalize and demonstrate, discharge planning reviewed. And again, in the home health mentor course, I have more templates like this, but this is the one I'll give you guys today. All right, guys, hopefully that answered all of your questions. If you have any comments, complaints, concerns, please let me know. Please subscribe to the YouTube channel, share this video, and by the end of the month, the home health mentor course will be released. I'm just getting more people involved in it. I want to make sure I have stuff for OTs as well. So thank you guys so much for watching. All right, hope you have a nice day.